Ladies and gentlemen, to today's tutorial. Today we are going to look at the perineum. Remember that the perineum, yes, is the region in between our thighs, where we have, the external, genitalia, as well as, the anal opening. Therefore, for the surface anatomy, you will say that it is the region which anteriorly you find, the mons pubis in females, and then for males, you find what we call the bulb of the penis. And then posteriorly, it will be related to the most superior portion of the intergluteal cleft. And then medially, it will be bounded by what we call the medial aspects. Laterally, it will be bounded by the medial aspects of, the medial parts of the thigh. But anatomically, we will have boundaries which, will be related to it. So without much ado, let's look at these boundaries for orientation. Now we've seen this over and over. Yes, this is actually, over here is the fibrocartilaginous structure that we find, which is, pubic symphysis connecting the two ospozes anteriorly. And then just on the lateral aspects, we are going to have the body of, the pubis, the body of the pubis. So anteriorly, yes, the pubis symphysis together with the body of the pubis will be related there. Then anterolaterally, there will be this bony, landmark, which we call it ischiopubic rami. Ischiopubic rami, which is actually formed by the inferior ramus of the pubis and the ramus of the ischium. Ischiopubic rami on either side, laterally, and then posterolaterally, we've seen this ligament, and these ligaments represent what we call the sacral tuberose ligament, because related to the the ischial tuberosity, the sit down portion where we sit, yes. So the ischial tuberosity all the way to the, the coccyx and the, sacrum. So sacral tuberose ligament, posterolaterally. And then posterior most, we are going to have the tip of the coccyx. So when you are asked to mention the boundaries of this, perineum anatomically, then anteriorly we are going to have the pubic symphysis together with the body of the pubis, and then anterolaterally by what we call the ischiopubic rami on either side, okay, and then posterolaterally we are going to have what we call sacral tuberose ligaments, and then posteriorly we are going to have the tip of the coccyx, forming the boundaries of this perineum. Now, this perineum, yes, we said that we are going to find structures which, the external genitalia, but not only that one, we also have some kind of openings of, the urinary tract, being the urethra. Then together, I also said that we are also going to see what we call the anal portion, the anal opening. Therefore, for descriptive purposes, now if you look at this area, this boundary that I illustrated, it is having a four-sided outline. And we say it's, diamond shaped. It is having a diamond shaped, appearance all the way here. So this diamond shaped appearance will actually be divided into two by an imaginary line which passes through the anterior aspects. This is these are the ischial tuberosities. This anterior, imaginary line that we are going to draw will pass through the anterior margins, okay, of the ischial tuberosities this way, not just over here, but the anterior margins of the ischial tuberosities this way. Once I produce this, then I'm able to divide this diamond-shaped, perineal region into a smaller anterior triangle, which is going to bear, as you can see, there's the vestibule of the vagina. Therefore, we're going to, bear the genital structures together with, the urethral structure. For female, you are going to find the urethra also here. So this triangle, the smaller anterior triangle that I'm able to get, will be called urogenital triangle. urogenital triangle. And the larger posterior triangle that we find all over here will be called the anal triangle. So these are for descriptive purposes. The perineum is divided, diamond-shaped perineum is divided into two triangles by this imaginary line going anteriorly through the two ischial tuberosities. A smaller anterior triangle bearing the genitals and of course the urinary structures, therefore we calling it urogenital triangle, and the larger posterior triangle bearing the anal opening, therefore we are going to call it the anal triangle. Now if you look at the anal triangle, now let's look at what will be the boundaries of this anal triangle. Then posteriorly, this anal triangle will be bounded by the tip of the coccyx, okay, posteriorly. Then on the lateral aspects, laterally, it will be bounded by what we call sacrotuberose ligament. And then of course, anteriorly by this imaginary line running through, the anterior ends of the ischial tuberosities. So these ones will represent the boundaries. Now if you look at the roof, okay, the roof of this anal triangle, it will be formed by actually the pelvic floor muscles. Remember that the pelvic muscles forming the floor also will therefore form the roof of what we call the perineum. So forming the floor of the pelvis, but will form the roof of this perineum, because above this perineum. Then we will also have its actually base, or for that matter its floor will be formed by actually the skin with associated fascia. But remember that this anal triangle will bear, yes, the anal opening, the orifice, anal opening or anal aperture will be there, and it will be also surrounded by this muscle which goes around it, and this is the external anal sphincter. Now this external anal sphincter is made of skeletal muscle, therefore it is voluntarily controlled. So once defecation is supposed to come, yes, you will have to cause it to open for the fecal matter to come out. So it is voluntarily controlled, made of skeletal muscles. Now, in addition, on either side of this centrally placed anal orifice, together with its associated muscle, external anal sphincter, we are also having what we call ischio-anal fossa. Now you realize that this is the ischium, so bounded around this area. So ischio-anal fossa, or so-called ischio-rectal fossa. So either you call it ischio-anal fossa or ischio-rectal fossa. This area is filled with fatty tissue, together with some muscles. It's actually fibromuscular with a lot of fat around this area. Now what happens is that yes, the muscles are going to help by way of contracting to help contribute to defecation. They are going to help in that regard, but mainly we are going to find fats around this area. Now more importantly is what we call the smaller triangle that we saw, being the urogenital triangle. Now for better orientation, for better understanding of this, I have made some kind of material to help us. Now if you look at this, these represent the muscles of the pelvic floor. Remember that we've seen two groups of muscles of the pelvis. We have those ones which are going to insert on some part of the lower limb, going to help medial rotate the lower limb, lateral rotate the lower limb. Okay, then what happens is that we have also muscles which are going to form the floor. I'm interested in the muscles of forming the floor, the levator ani muscles as well as the coccygeus muscles. Please visit that video to get more insight in that. Now for these ones, now please look at this. You can see these structures, okay, which we've seen already. Yes, I mean the rectum is there, piercing through it. We've also seen the vagina, yes, as well as the urethra, which you can also see them here. Okay, so this is the vagina, this is the anal canal. Okay, then there will be urethra, anterior. These ones are able to pierce, okay, from the pelvic region into the perineum. They're able to pierce through the pelvic region and enter the perineum. But there are some structures which we call them the pin structures, which are the pudendal nerve, yes, with root values S2 to S4. Apart from pudendal nerve, internal pudendal vessels, yes, together with nerve to obturator internus. So using the word nerves or pin structures actually. Yes, these structures, they don't get a pathway to go through the pelvis and enter the perineum. Therefore, for them to enter actually the perineum, moving from the pelvis, then they have to move through what we call the greater Shiatic foramen. Okay, so this is the greater Shiatic foramen that we find, and okay, so for simplicity's sake, we've seen this. Now, I'm saying that the anal canal, for that matter, rectum, continuous anal canal, yes, the vagina, yes, the urethra, are able to move from the pelvic region and enter the perineum. Okay, but for these structures which are going to supply, okay, give some, innervation as well as vascular supply to the perineal structures, are not able to get pathway through the perineum or through, from the pelvis into the perineum. Therefore, they will have to move actually from, okay, as you see it, they will move from what we call the greater Shiatic foramen and enter the lesser Shiatic foramen. Remember that an important bony prominence that is helping to separate these two foramina is actually the ischial spine. Okay, so that we can get these two notches later converted into those respective foramina. So the ischial spine will therefore be related to these pin structures as well. So the pudendal nerve, internal pudendal arteries and then veins, as well as nerve to obturator internus, they will be related to the ischial spine. And then they will enter, the lesser Shiatic foramen and actually go through, this area, which is actually thickening of what we call the obturator fascia, okay, separating to allow for the passage of actually the pudendal nerve and of course internal pudendal artery to enter, from actually from here, this is the ischioanal fossa, okay, part of the anal triangle, to actually enter the perineal, urogenital area, urogenital triangle. So we will look at some aspects pretty soon. Now, so just remember this concept that more deep, we are going to find what we call the pelvic diaphragm. So remember the structures this way. More deep is the pelvic diaphragm, and then you come to the next one, which consists of two layers, which we call it the urogenital diaphragm. So we are at the area where we are having the urogenital structures, okay? So the urogenital, triangle, that's where we are. So just by way of illustrating it, I've made this diagram. So let's try and understand this one. Now, assuming these represents the muscles, okay, the most superior one. So from here to here, as you come this way, then you are going inferiorly, or you are going superficially. But as you go from here to here, you are going deeper, or you are going superiorly. So it's either we use them interchangeably. So you can say from inferior to superior, from superior to superior, inferior to superior, or from superficial to deep, and vice versa. So let's try and understand this one. Now this is the anterior aspect, and this is the posterior part. Now you see that this is the most, the most deep structure, and for that matter, the most superior structure that we find, that is the pelvic diaphragm. The pelvic diaphragm, and then below this pelvic diaphragm, we are going to have this double layer. So this is the superior layer of it. This is the inferior layer. So this double layered structure that we find is known as the urogenital diaphragm. This is the pelvic diaphragm. This is the urogenital diaphragm. And posterior to it, yes, you are going to have, of course, the anal triangle. But we are interested in anterior portion, being the urogenital, triangle. So the diaphragm over there is known as urogenital diaphragm. We are saying that this urogenital diaphragm is made of two layers, a superior layer and an inferior layer, or a deep layer and a superficial layer. So the superior layer of urogenital diaphragm, then we have the inferior layer of urogenital diaphragm. Now, the inferior layer of urogenital diaphragm is also known as, the perineal membrane. Perineal membrane. So if you hear perineal membrane, which I'll be making use of it often, then it means the inferior layer of urogenital diaphragm, or the superficial layer of urogenital diaphragm. We are moving from deep to the inferior portion. Now, again, what we are going to find is that, yes, in the anterolateral abdominal wall, we saw that below the umbilicus, the superficial fascia, yes, the abdominal wall is not having a deep fascia. The superficial fascia is actually split into two. Now, I'm interested in the deep membranous fascia, which is over here, which is known as Scapus Fascia. Scapus Fascia. Now, this Scapus Fascia, yes, moves inferiorly, into the scrotal region, and form, the dartos fascia. Yes, we know that in the scrotum we are going to have the dartos muscle, which is one of the panniculus, canosus muscles, which will contract and cause, wrinkling around this, scrotal area. So we have the dartos fascia, blends become dartos fascia, and then goes posteriorly, so to become what we call, Colles fascia. Colles fascia. So from the anterolateral abdominal wall, anterior abdominal wall, we are having, yes, Scapus fascia. In the scrotal region, we are having what we call dartos fascia. Then in the perineal region, yes, we are going to have Colles fascia. Remember that in females, the analog of the scrotal sac is going to be the labium, minora, minus, the repura being labia majora. Labia majora. So that's what we are going to find over here. Now, what we find is that anteriorly, connecting. Now, look at this. This potential space, between what we call the superior and inferior layers of the urogenital diaphragm creates this potential space, which we call it deep perineal pouch. Deep perineal pouch. And then below that, we're also going to have what we call, superficial perineal pouch, because it's more closer to the skin externally. So this is deep and this is superficial. We said that we go this way, as we move this way, we go deep. As we move this way, we are going more superficial. So what we are going to find is that the deep perineal pouch, yes, superiorly, or its roof, will be bounded by the superior layer of the urogenital diaphragm. Inferiorly, by the inferior layer of urogenital diaphragm, or the perineal membrane. Now, posteriorly, it will be formed by actual diffusion of the superior and inferior layers of the urogenital diaphragm. And then, anteriorly, they are going to be joined, by thickness of their, fibers. Actually, over here, their fascia will thicken, forming actually what we call transverse perineal ligament. Transverse perineal ligament, connecting them anteriorly. So remember that the deep perineal pouch is closed. It's not open. It's closed. Now, how about the lateral aspects? Remember that the lateral aspects will be, yes, what we call the ischial, will be by what we call the ischial pubic rami, ischial pubic rami, because the ischial pubic rami is on the lateral aspect, anterolateral aspect. So, and remember that this one is more anterior than what we call the anal triangle. So laterally will be the pubic rami. So that's what we are going to find. Okay, now if we look at this one is what we call the superficial perineal pouch. So deep here, superficial perineal pouch. For superficial perineal pouch, yes, its roof will be formed by the perineal membrane or inferior layer of urogenital diaphragm, inferiorly by this Scapus Fascia, posteriorly by the fusion of Scapus Fascia and Perineal Membrane. And then on the lateral aspects will be by ischial pubic rami. So laterally their boundaries are going to be the same by what we call ischial pubic rami. But anteriorly it's actually open. So remember that the superficial perineal pouch is open, unlike the deep perineal pouch which is closed. Therefore, that is why you see this is the urethra. If there is an injury around this area, okay, and there's extravasation of urine is leaking out from the urethra because of an injury over here, then what will happen is that the injury, now this is the perineal membrane. Therefore, the urethra in there is known as membranous urethra. So if there's extravasation of urine in the membranous urethra, then it will be confined to what we call the deep perineal pouch. So that's what we find over here. Now, for the superficial perineal pouch, if there is an injury to the bulb of the penis, okay, around here, and there is extravasation of urine, then that urine, yes, will be in the superficial perineal pouch, all right. But because this, have a direct communication with the scrotal sac, it will go into it as well. You find also in, the scrotal region, and it also even move to the anterior abdominal wall region. Yes, it is continuous with it. It can even go to the level of, actually the clavicular region. Yes, even at the level of, the floor of, the axilla. So the urine can actually, seep in and go through all these regions. Now remember that it can even go to the thigh, but because of the fascia lata, okay, the thigh is having a deep, that kind of membranous, fascia, which is known as fascia lata, which is continuous with, actually the Scapus Fascia. Around that level, it can even go up to the level of the, fascia lata. And remember that where the fascia lata and actually the Scapus Fascia is known as Holden's, fascia or Holden's point. Okay, that's where it's actually going to end. So all these areas can actually happen in there. So that is the general picture that we have to understand as far as the perineum is concerned. Just try to understand these things by way of the boundaries and all that. All right. Now, having seen, these, perineal structures, these structures, then the next thing that we want to see is that what will be the content of each, portion of the perineum, each perineum. Now, please look at this by way of showing you these things. Okay, so this over here, these small things that you find here. Okay, this is a superior layer of urogenital diaphragm. This is the inferior layer of urogenital diaphragm. Therefore, together we have the perineal membrane. The perineal membrane, we say that there's going to be a potential space between it, and that is the deep perineal pouch. Below it, we are going to have what we call superficial perineal pouch. So that is one thing that we have to, know about this. Now, if you can see this is what we are talking about as, the perineal membrane. And remember that the perineal membrane is the inferior layer of the urogenital diaphragm. So we want to look at, yes, what will be the content of these, pouches, the superficial and deep pouches of the perineum. So let's begin with the deep one. So with the deep one, we are going to find, so this is what I drew to show. With the deep one, so remember this is the deep, okay, portion. This is the perineal membrane, so therefore that's the deep, portion. Now we are going to find, the following. But before I explain this, let's look at something. There are some structures which are going to be common to both the superficial and deep perineal pouches. For instance, if you talk about, the pudendal, nerve, as well as, the internal pudendal vessels, then we are going to see that. Now look at it. This is the perineal membrane, as you can see, the numbered one. That's the perineal membrane, the whitest portion, perineal membrane. Now these, pudendal nerve as well as internal pudendal arteries actually pierce through the perineum, the perineum, okay, the perineal membrane, and entered, actually the superficial perineal pouch. So it's content of both, they are going to be content of both the superficial and deep perineal pouches, actually. So that's one thing that we are going to find, actually. Now, for the deep perineal pouch, now what we are going to find is that we are going to find actually the bulbourethral gland. That's the corpus gland. So corpus gland will be in the, perineal membrane, and for that matter will be a content of the deep perineal pouch, which you don't find here. So the bulbourethral gland is going to be a content of the deep perineal pouch. Now again, we are going to have what we call external urethral sphincter. Remember that in females, we are going to have only external, they don't have internal urethral sphincter. So females are going to have external urethral sphincter. Now because they don't have internal, we can also call it, sphincter urethrae. So in females, it's better we use the word sphincter urethrae instead of saying external urethral sphincter, because they don't even have the internal. Remember that the internal is going to help, to prevent retrograde of semen into the urinary bladder. So that's also another point. Then, of course, we also have what we call the, let me show this one. We also have what we call the deep transverse perineal membrane, which, of course, we don't find here. But one thing that we have to know is that there is this muscle over here, which is known as, superficial transverse perineal muscle. Now, deep to it, we're going to have what we call deep transverse perineal, muscle. These muscles are going to be part, of what we call the deep, pouch of the perineum, deep pouch of actually the perineum. So let me just look at some of them too. Now, in addition, as we saw, we are going to also have, this urethra being the membranous urethra, okay, which is also a content of the deep perineal pouch. So over here, membranous urethra will be part of, the content of the deep perineal pouch, membranous urethra. Then we also have the dorsal nerve, yes, of the penis or the clitoris, which we don't find here. It's also a content of actually the deep perineal pouch. But the dorsal artery of the clitoris and the dorsal artery of, let's say the penis, it's a content of both, the deep and superficial perineal pouches. So these are some of the content that we are going to find in what we call the deep perineal pouch. We are going to find, yes, the bulbourethral gland. We're going to have the membranous urethra. We are going to have the external urethral sphincter or sphincter urethrae. Then, of course, we are going to have a dorsal, nerve of the penis or the, the clitoris. Remember that the clitoris is an analog, of the penis in males. Now, for the superficial perineal pouch, now look at these muscles. Now, this is the perineal membrane. Therefore, anything within it here, because that we'll talk about the Scapus Fascia. Okay, we'll be covering it around this area. So everything here will be a content of the superficial perineal pouch. So namely, we are going to have this muscle which is moving all the way from here, okay, from actually the ischium to the cavernous bodies. So we call this one ischial cavernosus muscle. Ischial cavernosus muscle on either side. Ischial cavernosus muscle. Then around the bulb of the penis, or the bulb, of the vestibule, we are going to have vestibule of the vagina. We are going to have what we call the bulbospongiosus muscle. Bulbospongiosus muscle being a content. Okay. Then of course, the clitoris, will also be a content, actually. So these are some of them. Then of course, we are also going to have what we call this gland, which is known as the Bartholin's gland, or the greater vestibular gland. Remember that the greater vestibular gland is needed, actually for lubrication of, the vaginal opening, prior to, sexual intercourse. So that is the Bartholin's, gland. Now this Bartholin's gland could be infected, by actually, either a Escherichia coli, yes, or even, Staphylococcus aureus that can actually infect it, causing some fluid-filled cysts, in there, which makes it, very much painful. Becomes that kind of disease, and that is what we call Bartholinitis. Now, remember that this Bartholin's gland is therefore analogous to what we call the corpus gland, or the Urethra gland, which was a content of the deep perineal pouch. This is actually a content of the superficial perineal pouch. Now, we will also have what we call, the posterior, artery of the clitoris, or even that of the penis, being content of this, area, the superficial perineal pouch. Now remember that over here, which I want to explain. Now over here, as you see over here, there is this body over here, which we call it perineal body, a fibromuscular structure over here between the anal canal and actually, the opening of the vagina. Okay, this one is known as perineal body. Now this perineal body is very important because several muscles have attachment to it. Yes, the levator ani muscles, together with external anal sphincter. Yes, apart from that, we are going to have the transverse perineal, superficial transverse perineal muscle. We're also going to have what we call we are going to have actually the bulbospongiosus, okay, having attachment to this perineal body, and that is why we call this perineal body central tendon of the perineum. Therefore, it's very important for actually supporting, okay, for keeping these pelvic viscera, or the perineal viscera, intact, so that during parturition, if there's going to be tear, there's that suspicion of tear here, then what will happen is that there should be an incision, surgical incision made through the perineum to actually ease childbirth, so that this perineal membrane, or the central tendon of the perineum, doesn't become deformed, doesn't get fractured, or doesn't get torn, which will lead to prolapse of the pelvic viscera. So that is the perineal membrane. Alright, ladies and gentlemen, I hope you enjoyed this tutorial, and we will actually look at later, when we look at the male and female reproductive system, we will learn more about these things. Thank you very much, and may God richly bless you.